So Dr. Shankara Chetty is a general practitioner with a natural science background in genetics, advanced biology, microbiology, and biochemistry. He has become recognised the world over for his successful management of COVID patients. His broad natural science background afforded him a unique perspective of the pandemic, convincing him that something was missing. Despite a wealth of knowledge around hospital presentations, pathology, and investigations, he saw that there was a distinct lack of information on initial presentation, progression, and pathogenesis. Particularly, I've been interested in your 8th day observations, Dr. Chetty.
Good evening to everyone there in New Zealand, where I think the majority of viewers are. Yes, what we present today, we're providing an understanding of a perspective of what's happening with COVID. And it's not meant to be medical advice to be taken without the consultation of your general practitioner. COVID is a serious illness and it shouldn't be taken lightly. As much as we found ways to treat this and negate mortality and morbidity, I think your GP should be involved in any decisions you make.
Awesome. Well, thank you and welcome again. And I'm just wondering if we could start off, if you could give us an overview of the clinical observations that you've made over the past 18, 20 months of treating over 7,000 patients within your practice, especially the 8th day observations that you've come across.
Okay, to put it into a nutshell, I endeavored to examine every patient that came into my practice. I didn't do telemedicine and things like that. I wanted to understand why people were going into hospital. And in the first wave, we knew that the breathlessness was what was driving this pandemic and causing all the mortality and morbidity. So I wanted to interrogate that a little further. Before the pandemic got to South Africa, there was a lot of fear from my clientele about not being available, but I made sure I encouraged them that I would be available and they must come to me early so that I could understand the illness. Very early on, patients started presenting very early with symptoms. As soon as they had a sore throat, they came to see me. And I educated every single one of them to present back if symptoms worsened. I wanted to understand from a clinical picture exactly what was going on with this illness and why people were actually ending up in hospital. From the world around, before the pandemic hit South Africa, we knew that people were deteriorating relatively quickly. We were hearing stories about people collapsing on the streets and things like that. And that didn't sound like a viral illness. It sounded something strange. We have a wealth of knowledge, which we can always fall back on. And when we analyze such things, it's not about randomized trials, but more about looking at the unusual cases to bring some understanding. Doctors usually discuss this kind of thing in the lounge at the end of the day. And that's what brought scientific discovery, not randomized trials. So I wanted to understand what was unique about this illness itself. And so I asked patients that they come back if symptoms worsened. Very early on, I noticed a trend. I had a subset of patients that came back breathless. Not everyone. I think it was about 20 or 30% at the time. Those patients that came back breathless, strangely enough, presented exactly a week after the onset of their initial symptom. I went back, I checked my records, I started interrogating patients about the exact day that they started to feel unwell, and I noticed that the breathlessness always started exactly a week after the initial symptom or the initial feeling of being unwell. And that seemed very strange. As well with these patients that presented back, when interrogated about the progress, the day before they started to feel breathless, they were perfectly fine. They had thought that they had recovered. And of course, that tied in with all the narrations of people that had demised. It's always narrated that from family members that they thought the individual was getting better and suddenly took a turn for the worse. So it seemed like there was a turn on the 8th day. Something seemed to be changing on that day. Now, with that change, I knew from the start I had to get myself a toolbox of drugs that might work in this. Now, the first 7 days of illness seemed to be an ordinary viral flu. There was absolutely nothing unusual about those 7 days. Some had sore throats that resolved within a day. Others got co-infections with bacteria and needed antibiotics. And I think we all respond to viral infections slightly differently. Some of us are more resilient than others. You hear people saying it always goes into my chest. And so I think we knew how to treat that first phase. But on the 8th day, I needed to do something different. Something had changed. And steroids, we knew that this was a steroid responsive illness. So that formed a timeline and a point in time where to initiate steroids without being too aggressive, but with also not dousing your immune response. So it seemed like people had recovered and something else had started. Now, I started with steroids on the first few patients. They showed signs of improvement with recoveries. But I had it at the back of my mind that I was dealing with an allergic process from before the pandemic came. From looking at the presentations around the world and that kind of thing, I had a suspicion that we're dealing with some kind of immune response here on the 8th day. Well, the 8th day came to be once I started to examine these patients. It took 2 or 3 days for patients to start to show signs of recovery with the steroid itself. So I decided that I would have to attempt what I'd call a therapeutic trial of different medications. The speed to recovery using those different medications will dictate the underlying mechanism. And so by, I think, the 5th patient, I had a lady that was in her 40s, that was diabetic and hypertensive, who came in on the 8th day, who was perfectly fine the day before, and she had a saturation of 80%. The more critically ill patients I'd seen. And so I decided, well, I was well aware of the time to recovery with steroids. It took a few days for them to improve. So to that steroid, I added a kid's dose of promethazine because I was suspicious we're dealing with a hypersensitivity reaction here. And with that kid's dose of promethazine, I followed up on, well, every one of my patients from the 8th day. They got a phone call every day to ensure good clinical recovery. And amazingly, by the next day, she was perfectly fine. Her saturations were fine. Everything had resolved with a kid's dose of antihistamine, but I had just given her a single day of treatment. So I asked my staff to contact her and remind her that if the breathlessness resurfaces, she needs to come back. I suspected that it would, seeing that we'd just given her a day of antihistamine. And by the following day, the breathlessness did show up. And so she came back and we treated her and she resolved again very quickly. And that drew my attention to this being a hypersensitivity reaction triggered by something on the 8th day. Now, when you look at viruses tend to have a finite replication cycle. Measles only lasts that long, chickenpox as well. It has an evolution to it. We can track the illness. And so I decided I needed to track this illness through and to figure out exactly what was triggering this process on the 8th day. Now, the first 7 days seemed to be a viral infection. And by the 6th or 7th day, a majority of patients got their appetites back, which is usually a sign of recovery and your immunity kicking in. But everything took a turn on the 8th day with some patients. Now, understanding that it was hypersensitivity, hypersensitivity causes the release of certain chemical mediators, like a bee sting, and you'd have a varied degree of allergy to such an allergen. So some would have very mild symptoms, some moderate, and some very severe, bordering on anaphylaxis, and would deteriorate very rapidly. Now, when you treat patients on the 8th day, you can't wait to see how severe they actually are. They could deteriorate too quickly. And this is a process, if not caught early, will cascade out of control very quickly, like a bee sting if untreated. So every patient was started on aggressive treatment on that 8th day. We looked for quick clinical improvement, and the clinical improvement determined the dosages and the weaning of certain medications. Now, the mediators that get released are fairly well known to almost every doctor on the planet. When you have an allergic reaction, you have the release of histamine, you have the release of leukotrienes, prostaglandins, and platelet activating factor. Now, those 4 mediators need to be addressed. So the protocol that I started when I realized that this was a type 1 hypersensitivity included antihistamines, montelukast for the leukotrienes, and aspirin to prevent any clotting issues. I did look at ginkgo biloba. Ginkgo biloba is a supplement that actually is a platelet activating factor antagonist. And so it's the only one that I could find that would work targetedly at platelet activating factor. So I started that kind of regimen. As well, you got to stop the process. This is just mopping mediators. And to stop the process, steroids become vitally important. So you've got a tap that's opened and is spilling out these poisonous mediators, and the longer you leave it, the more damage it will do. The dose of steroid is vitally important in such conditions to stop the reaction itself. And that is how this protocol has evolved. From the 8th day, if the patient worsens, they're having a severe allergic reaction, and you got to be aggressive and timeous in catching that reaction and treating it. The dose of steroid would be determined by the severity of the reaction, and the severity of the reaction can be gauged by the speed of recovery. So I give a patient a dose of steroid and I expect within 4 to 6 hours to see improvement. If not, I repeat that dose until I get improvement. There's been a lot of controversy about the dose of steroid. I think that we need to understand what we're trying to treat so that we use the appropriate medication. The whole world has been chasing COVID pneumonia. This is not a COVID pneumonia. This is not a COVID pneumonia. This is not a COVID pneumonia. Pneumonia is a progressive illness, and you can see the patient deteriorate day by day until they develop pneumonia and become breathless. I've never had a patient that was perfectly fine and suddenly woke up one day tired and by the evening was breathless with the pneumonia. So this is actually a hypersensitivity allergen-induced pulmonary pneumonitis, not a pneumonia. So it's an allergic reaction occurring deep in the lung. It does affect the vascular system and the rest, but it is typically an allergic reaction occurring in the lung, and that's the reason for the speed of evolution. Anaphylaxis can occur very quickly. Now, if you compare these two conditions, COVID pneumonia and pulmonary hypersensitivity pneumonitis, on X-ray and high-definition CT with the ground glass appearance that we've been seeing, both are identical. They cannot be told apart by X-ray or CT. So I think we've been misdiagnosing COVID pneumonia as COVID pneumonia. We're dealing with the hypersensitivity pneumonitis. And so I think the perspective took precedent rather than any medical intervention to understand that we're dealing with a biphasic illness that is nonlinear. The first and second phase have no correlation between each other. The second phase can be mild, moderate, or severe, and I think the distinction of severity should start on the 8th day rather than from the first. A majority of patients do not have this reaction and are not at risk of having a hypersensitivity. All the mortality and morbidity in this pandemic resides in that part of the process. So the second phase is responsible for all the mortality and morbidity. So to put it into context, the virus is like a bee, and the sting is the allergic reaction. So we as a planet have been busy counting bees and chasing bees and trying to kill bees, but we haven't addressed the sting. And the patients that have been stung by this are advised to go home and isolate and wait till they deteriorate. Unfortunately, by that time you have multi-system disorder. You've damaged your body in many ways. And of course, presenting to a hospital is a bit late. That negates the speed and aggression with having to address this. And of course, a majority of doctors in the hospital are unaware that you've been stung with the bee. So the appropriate method of treating it is not available to you then. And so the perspective is vitally important rather than any treatment protocol.